taking good care of your health means not only eating right and being physically active, but also regularly checking an important health factor that you might not think about, and that is blood pressure. Many people who have high blood pressure do not know it, and high blood pressure or hypertension is dangerous because there often are no symptoms. Dr. B joins us now, Dr. Brent Wallis from People's Health, here to share some blood pressure facts we all need to know. Hey, Doc, how you?
I'm good, Tommy. How about you?
I'm great. I hope you had a good week. It always, I guess disparity might be the word as it relates to blood pressure, because it can be so serious. You don't know you have it, but yet it's so easy to take care of if you do. Is any of that accurate at all?
Yeah, very much so. I think the majority of people before they're diagnosed don't even have a clue that they have elevated blood pressure.
So what is blood pressure? Because we hear about it, but we don't really know.
Yeah, it's the way that I think about it is blood pressure is really it's a measurement of the force of your heart beating, and so when your heart beats against the walls of your blood vessels, it creates a pressure, and we measure that in two different numbers: a systolic, which is the top number, and a diastolic, which is the bottom number. So that top number is when your heart beats, it pushes the blood up against the walls, and we can measure that number. And then when your heart relaxes, the blood is still moving through there. It doesn't stop. And so that's the lower number, which is a lower pressure of the blood moving.
I had no idea. I knew 120/80 was perfect. I think that's what, or at least I don't even know if there is perfect. What are good blood pressure readings? Does it depend on age, health, gender, weight, etc.?
Yeah, I mean, we usually consider anything below 120/80. You're right there is ideal, and anything above that is of concern. So even when the top number is elevated up into the 120s up to 129, we consider that pre-high blood pressure, so that's something that you should be watching and talking to your doctor about. Anytime you go above 130, though, then that is true high blood pressure, and so a lot of times that needs to be treated, and that can be treated with either medication or sometimes lifestyle changes can help as well. The important thing to remember about blood pressure, though, is that it changes all the time, and so a single high reading doesn't mean you have high blood pressure. It's when it's consistently high that it's of concern for your health.
If somebody goes to the doctor, and my mom used to say this all the time, they check her blood pressure, and they'd say, well, she would say, well, I'm just nervous for being here. Can there be like temporary spikes if you're under pressure, nervous, what have you, lying to the doctor about what you ate? Can some of that cause your blood pressure to go up?
Yeah, definitely. We see something called white coat hypertension, which is when you go to the doctor and we scare you and your blood pressure goes up. But even that, you have to kind of watch and see, is it consistently high? Because even white coat hypertension, if it happens every time you get scared, then that can be of concern as well.
Does the lower number automatically drop with the higher number, or automatically elevate with the higher number, or can they go in different directions?
They can go in different directions. Typically, they'll go up together. But what we do see sometimes in our senior population is that the lower number may actually drop a little bit, and so you'll get a greater difference between the top number and the bottom number. So we watch that a little bit too, because that can be signs of other things going on.
So I go to the doctor, and I'm about to lie to you, which I'm not really afraid of you. I'm afraid of the lie that I'm about to tell you about what I've been eating. And the top number is 140 and above. At that point, should I immediately see another doctor about blood pressure, or realize that if it's over 140, chances are that's not white coat hypertension? That's something serious going on.
It definitely could be, and like we were talking about, a single reading usually we don't designate you as having high blood pressure. So typically, what your doctor would do is say, let's have you come back in a week or so, and let's recheck your blood pressure, because there's a lot of things that can affect it. You could have had too much coffee that morning. You could have hit a lot of traffic driving into the clinic, and sometimes that can raise your pressure too.
All right, so stage 1 is between top number 130, 139, bottom number 80, 89. Stage 2 is when the top number is 140 and above, and the bottom number is 90. And even if it is just that top number is 120 to 129, that's considered pre-hypertension. So we're going to take a break. When we come back, we'll talk about symptoms for high blood pressure, how it can be treated, how can it affect your health, and medicines, etc. So a lot of information here coming up. If you have any questions, text them to 504-260-1870, and I'll try to get them to Dr. B with People's Health. Real quick, Dr. B, somebody asked about pulse and resting heart rate, or is that play a part in blood pressure or not?
Not so much in blood pressure. That's really more kind of a measurement of what your heart's activity is itself. We do actually listen to the pulse in order to check the blood pressure, so that's how they are related.
Can that be too low? Well, I mean, obviously it can be too low if it's nothing, but can it be like, is 50 good? Is the lower number necessarily better?
It's not necessarily better, because once you go below 60, in a lot of instances, that may not be enough force of blood to get everywhere it needs to go. So as it drops, you can actually develop additional problems. So that's something that you definitely have to talk to your doctor about as well.
25 now, Tommy Tucker, WWL. We are back with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Somebody texted in and said, Dr. B is your best regular guest. Well, it's not a competition, but he is pretty damn good. All right, Doc, so sometimes they don't have symptoms for high blood pressure. How do you know if you have it if you don't have any symptoms?
Yeah, that's the hard part. You can go a long, long time without having any idea that your blood pressure is elevated. So that's why it's so important to go see your doctor. And especially if you're over age 40, you should really be going to see your doctor at least once a year. And they're going to take your blood pressure always at the time of the appointment, and then they can tell you if you might have a problem.
And how does that affect your health? What does it actually do if you have high blood pressure?
Well, the force of that blood, the high pressure, can actually cause problems in a lot of different areas of the body. In particular, it can actually cause difficulty with your heart beating, and so that can lead to enlargement of your heart, which typically we think of as congestive heart failure. That's sort of long-term complications. But real high blood pressures can actually also lead to heart attack and stroke as well. And then, another thing I worry about a lot with anybody with long-standing high blood pressure is kidney problems. Your kidneys are basically a little small bag of blood vessels, and that blood forcefully going through there can actually cause some problems with your kidneys that can lead to a lot of serious problems as you age.
Is everybody at risk? Are there people who are at higher risk to have high blood pressure?
Yeah, certainly. Seniors in particular, it's very common for you to have high blood pressure, and it runs in families. And so if you've got parents or brothers and sisters who've been diagnosed with high blood pressure, you should definitely get checked by your doctor, because it's real common for families to have it. The other groups I worry about, race plays a role, definitely. So African Americans have a much higher incidence of high blood pressure, and then people who are inactive, people who are overweight, people who smoke or drink too much alcohol can definitely develop high blood pressure. And then people with really poor diets, salt in particular, can actually increase your blood pressure. So you have to be real careful. It's okay to cook with some salt, but you don't want to use the shaker too much, because that can elevate your blood pressure too.
What about some of the lifestyle changes you can make? I guess there are medicines, certainly, and are there other ways to control it?
Yeah, definitely. You don't have to jump straight to a medication. Maintaining a healthy weight is very important. Exercising helps blood pressure a whole lot, so at least 30 minutes, 5 times a week is real important. We talked about limiting salt. I think that's critical. And then also balancing your diet with fruits and vegetables and whole grains. And then, like I mentioned, quitting smoking really can lower your risk of high blood pressure as well. And then one of the other big things we talk about is stress. So, trying to manage your stress and lower your stress level can help keep your blood pressure down as well.
And if you are taking medications?
Yeah, the most important thing I always make sure people know is take them all the time. So blood pressure medicines are not to be used like antibiotics where you take them for 10 days and then you're cured. Blood pressure medicine, once it's started, needs to be continued, and people tend to stop taking them because they feel better, but you feel better because you're taking the medicine. So it's real important to make sure you keep going on your blood pressure medicines.
Yeah, I'm guilty as charged on that. It runs in my family. I don't stop taking the blood pressure medicine because I know how important it is, but it's something about human nature. You give you medicine, you take it, you feel better. Why am I taking the medicine? Because it made you feel better, but you never make that connection. How can we find out more about people's health, Doc?
Well, you can always go to our website at peopleshealth.com/radio, or you can call us at 855-821-2666.
And, of course, Facebook, Twitter, Instagram. One quick question. I do have it. It's under control with medication. So when I go to a doctor's office and I'm filling out the forms and they say, do I have high blood pressure? I don't know what to put.
Yeah, if you're taking medications for it, you have high blood pressure, even if it's controlled. So let them know that.
Well, that's a lot of forms I got to go change. Thank you, doctor.
Thanks, Tommy.
You have a good week.